So we've been very focused that competition is a means, not an end. And over the last 4 years, we've been really trying to introduce competition into the East of England to drive up the quality of patient services. And we've done several things to do that. We've had a very good dialogue with the independent sector in setting up a commercial advisory board where we've brought in some of the big independent sector providers and the small voluntary sector providers to talk with us about some of the issues about lowering barriers to entry and improving the dialogue between the NHS and new potential partners. We've set up an independent competition panel so that if there are competition issues in the East of England, then we can resolve them by taking outside advice and not stitching up as part deals as part of the NHS family and keeping. So we've been growing confidence in our ability to resolve competition issues, and we've started to East of England led the way nationally. We worked with 6 other SHAs on doing some health market analysis in early 2008, but we're not paying lip service to this sort of process. We worked up with primary care trusts right across the East of England in developing and identifying £1.9 billion of opportunities for driving up the quality of services and bringing in new providers. And we were only stopped by the problems associated with the NHS as a preferred provider policy that beset the competition agenda with the previous administration. And we've since further moved forward. We've not let that stop the push in the East of England. We've moved on to run some quite innovative transactions with the first competition for a foundation trust to take over a struggling NHS Trust at Bedfordshire and Luton Mental Health Trust, and we've also run the first open process to find a new partner to take on and deliver improvements in services at Hinchingbrooke, and that's been an open competition, and we've had some really exciting models of care being put forward.
What were your objectives in increasing competition?
Well, I should say again, we're not ideological about bringing in competition. Competition is a means, not an end in itself. And the East of England set itself a vision in 2008. It's called Improving Lives, Saving Lives. We developed 11 outcome-based pledges around improving the patient experience, delivering safe, high-quality healthcare and reducing unfairness in health. And we developed those priorities. We wanted to be the best region in the country. The East of England used to be a basket case. That's a technical term. We used to be seen as a basket case. We were £300 million in the red, and we wanted to turn the region round. And we wanted to do that by bringing in the best placed provider, not just any willing provider, but the best placed provider in to run services in the East of England and to drive up the quality of services. So we set ourselves the ambition of wanting to be the best and deliver the best possible services to patients, the public, and value for money to the taxpayer. And we've gone out and actively searched out the best.
Much of competition policy has focused on increasing patient choice into elective care, things like hip operations. You've done something even more interesting in East of England, where you focused on whole providers. Can you explain what you've been doing in Bedfordshire and Luton?
So Bedfordshire and Luton was on the road to becoming a foundation trust, but they had some serious quality and safety issues that they needed to tackle, and the board was focused on tackling them, and they realised that in tackling them they would not be able to deliver a credible foundation trust application in sufficient time to drive up services that were increasingly needed to be improved at Beds and Luton. So the board took a very robust decision that they wanted to find a high-performing foundation trust to take on and run the whole range of mental health services at Bedfordshire. And so they, with our help, have gone through a process of trying to find the best placed provider, and over an 8-month period, after which we had 22 expressions of interest from right across the country. This was a big national competition that attracted and generated national interest, we whittled this down to 4 excellent organisations from around the country, all excellent rated organisations on the old CQC annual health check rating system. And we eventually selected South Essex Partnership Foundation Trust to run services at Beds and Luton. And it was a phenomenal process. We got real innovation from all the bidders, but ultimately set out that they were going to invest nearly £7 million in services over the next 3 years and nearly £40 million of investment in estates, and really going to drive up the quality and standard of service at Beds and Luton. And it is worth saying that SEPT is no run-of-the-mill organisation. It is a truly high-performing organisation. Its chief executive was voted as and recognised as the NHS Leader of the Year in 2010. They were one of the first mental health foundation trusts. They are rated excellent on the annual quality annual health check by the CQC, a truly high-performing organisation. So we've not settled for mediocrity. We've gone out and actively searched for the best, and we've secured the best, and I think a real opportunity to drive up the quality of services in Bedfordshire and Luton.
And since Bedfordshire and Luton, you've moved on now to an even more ambitious programme at Hinchingbrooke. Can you explain what you're doing there?
Okay, so Hinchingbrooke is a small rural district general hospital in Huntingdonshire. It has got a £40 million debt on a £90 million turnover, and we needed to find a sustainable solution for Hinchingbrooke. We've been absolutely committed throughout that we want to ensure that Hinchingbrooke continues to provide the full range of services at Hinchingbrooke. So it continues to provide A&E, it continues and must continue to provide maternity services, the full range of services. But we wanted to find the best placed partner, the best placed provider to ensure that services continue to be provided at Hinchingbrooke, but we address the debt. So we've been running a competitive process since the autumn of 2009, and we have been in a dialogue with both the independent sector and the NHS about finding the best placed provider to run services at Hinchingbrooke, to maintain quality, to maintain safety, but also to pay off the debt. Now, we're concluding that process in November of last year. In November 2010, we identified Circle as the best placed provider to take on and run those services. They have plans to pay off the debt, and they have got a philosophy of empowering clinicians to really drive up improvements in productivity, and they've delivered nearly 20% gains in productivity in the NHS treatment centres that they've run. It's probably worth also saying that in running this competitive process, we've been developing a new model of developing partnerships with both the NHS and the independent sector. It's an operating franchise. And under this innovative operating franchise that we are looking at with Hinchingbrooke, staff and assets will remain in the NHS. So this is not privatisation. Staff and assets will remain in the NHS, but we were looking for a third party to run services at Hinchingbrooke, and in doing so, we've been able to ensure that we find the very best placed provider. So the NHS has been able to compete alongside the independent sector, and we've been out for the best deal for patients, the public and taxpayers.
There's been a lot of discussion in the media about any willing provider and potential privatisation of the NHS. Is Hinchingbrooke privatisation of the NHS? Absolutely not.
We're absolutely clear that staff and hospitals will remain in the NHS. This is not privatisation. We've been trying to find the best placed management team to run services at Hinchingbrooke. We've not been ideological about who we're prepared to talk to. We've been talking to the NHS and the independent sector. We've got really innovative proposals from Circle, who are a doctor-owned John Lewis-style partnership, who are going to drive up productivity. And but they're absolutely clear, staff and the hospitals will remain in the NHS and will continue to oversee the hospital and the staff through a trust board. So there are safeguards in place. We're not selling the family silver. Assets and staff and the hospital will remain in the NHS.
So how does Circle get paid then?
It's a very, very good question, but a very simple answer. We are asking Circle to run NHS services just like any other NHS provider. They will be paid at NHS prices. They'll have to deliver to NHS terms and conditions, NHS quality standards. They'll be paid just like any other NHS provider. They'll be commissioned just like any other provider. They will play by the same set of rules. There are no special favours here, no demand guarantees, no sweeteners. Circle have got to come in and provide services just like any other NHS management team.
And what are the lessons from your experience in Hinchingbrooke and Bedfordshire and Luton for the new commissioning board and the new economic regulator monitor?
Well, I think what we've started to do in the East of England, as well as bringing in innovative new ideas and spreading good practice, spreading innovation, which will ultimately drive up the quality of services, I think we've also started to establish a set of consequences for organisations that are struggling, are weak, are failing, are into major financial difficulty. And I think that will start to ensure that there are consequences for organisations that are not delivering. We're very clear that services, essential services, must continue, and we've developed a robust way of ensuring that those services will continue. And as a consequence, it will start to reinforce much of the white paper priorities in terms of driving up the quality of services, ensuring that essential services continue, but also not tolerating poor performance, poor financial failure.